I need you, guys and gals. So I wanted to be able to create something, a platform in which to be able to spread knowledge, health, and well-being to everyone around me. And in doing so, we've created this amazing community of patients and clients and friends and everyone wanting to learn more and more about what I've been doing. And now that the podcast has been taken off and people have been following me a little bit more on social media, there's a common question. Where did I learn all this stuff? And so over the past few years, I've been kind of cramming all this stuff together, and I've created this coaching platform where you have one-on-one access to me, and there are two different types of plans. There's a 6-month plan and a year-long plan for coaching, where I help you from how to start the business from the ground up, how to test properly. There's modules, there's handouts, there's basically all you got to do is say, hey, I'm in, pay your fee to get in. I will train you, I will coach you, I will get you up to snuff to make sure that you can start helping people in your community as well. And if you're like, is this for me? Anyone who has a beautiful heart inside, there is a vetting process for this, or an application process. I don't want terrible people joining this program because I don't want terrible people doing terrible things to people's health. You have to have a heart of gold here, really want to help others, and it doesn't matter what your background is. You could be a health coach, you could be a nutritionist or a dietitian, you could be a nurse practitioner, you could be a medical doctor, you could be a chiropractor. It doesn't matter. What I'm able to teach you is at a level that all the way up to like a surgeon can understand, all the way down to somebody who's never spoken a lick of health terms in their life. And then I can help to educate you to be able to formulate new custom protocols to be able to help patients in your community. So if that's something that you're interested in, please reach out to me so that we can start opening this up and enrolling new docs or new patients or new people into this program so that they can learn what I've been able to do so you can help me to help the world. Thank you in advance, and I look forward to meeting with you guys. Welcome to another episode of the Doc Jock Show. I am super excited to be able to have this guest on here today. So Natasha Wilch is somebody who has kind of forged her own path into becoming, in my opinion, one of the top leading experts in the concussion realm. And when you hear this podcast interview, it's one of the most action-packed, most informative, mixed with laughter, jokes, tenacity, passion. Like, you're going to get a mix of every single emotion while you're watching this episode or listening to it. So Natasha has been able to build protocols and procedures to help concussions. She's based out in Canada, but she is able to see patients worldwide. And they come to her, they fly in. She has intensive things that she does. She's a speaker. She basically does everything under the sun. And I'm really grateful that we had the opportunity to get her on the podcast. So be sure to tune in, strap in. It's going to be a longer episode, but I promise you it's going to be worth it. If you can't listen to it all in one go, either do it in time and a half speed or do it in 2 parts. It'll be worth it. We'll talk soon. All right, well, let's roll into this. So thank you, Natasha, for finally taking time out. We've been working on trying to get you on the show for, I think, almost over a year or so. But thank you for finally getting on here. I really appreciate it.
I am stoked to be here. It took us way too long to actually make this happen.
Awesome. So Natasha, so tell people a little bit about yourself. Who are you? Where are you? And how did you get into the world of concussions?
Yeah, so my name is Natasha Wilch, obviously. I'm a physical therapist up in Western Canada. So I live on Vancouver Island, which is beautiful in the summer and ridiculously gray and rainy the other 6 months of the year.
There you go.
But I have a brick and mortar clinic up here, and it's called Symphony Brain Performance. And I am a big proponent for collaborative multidisciplinary care. So that is what my team is. And we are honored to welcome people flying into our little, I always say, like, come into our little city. We're not a big place, but we welcome people in from all over Canada, the US, and the UK to come work with us in our concussion intensive program. So concussion is truly what I pour everything into. It speaks to every fiber of my being, my heart. Like, when you start to do things and you're like, oh, this feels good. And then you're like, yeah. From the day I had my accidental concussion client walk through my door where I literally had no idea what to do,
Yeah.
he like opened the rabbit hole, I say, to like deep dive, and I've never looked back. And like the creative sparks about what I can do in this space to fuel my bigger mission just keep coming. So
I love it. Yeah, and that's the thing too. Even from like some people will shift through what they're passionate about, and since the moment we started talking, we knew it was concussions, and your passion has just steadily grown. And then obviously the services and things that you offer, and the courses we'll talk about a little bit later. Like you can tell that the passion is there. Even before we hit the record button, we just chatted for probably like 20 minutes, just bullshitting back and forth on the importance of this. And when it comes to concussions, it's fortunately and unfortunately becoming a little bit more understood. And the reason I say unfortunately is because, you know, nobody should ever have to sustain a concussion, but I'm glad people are starting to open their eyes. And I know when I played football, I mean, we were taught to just get back on the field. Like I remember undergraduate freshman year, there's this dude that was mad at me for being an idiot, which is what I was. And he closed fists smashed the back of my head underneath the helmet, and my bell was wrong. Like it was like, ding! And I took a concussion test that was like so easy the day prior. I got it done in like 5 minutes. And then the next day they're like, hey, it didn't save. We need you to take it again. And I'm like, oh crap. And it took me 3 hours to try to figure out what the hell is a square or a triangle. Like it was so difficult. And the coach was like, are you just that dumb? I'm like, let's just not talk about it because I want to get back on the field. So that was what I knew about concussions. And then in 2009, having a traumatic brain injury, subdural hematoma, like the brain is one of the first things in embryo that forms the brain and nervous system. So let's dive into this brain stuff. So obviously you had this accidental concussion client, which, you know, I think was a godsend to you because this is what.
Me too, 100%.
Yeah. Right. So what have you noticed? So in terms of like the trend in concussions, how do you differ from the standard approach to concussions?
Well, that is such a good question.
I know.
And it's funny because so that like accidental client, I'm huge on, I tangent like a mother. So I'm just gonna like throw that out there to your audience.
Me too. We're screwed. So.
What were we on again? Yeah. I want to say like, so when that person came through my clients, I think this is important because as clinicians in either of our professions, I think sometimes there's this image that like, we need to be the smart ones and we need to be the people who know everything. We don't know everything. Yeah. We never fucking will. Sorry, I'm not going to swear.
There's no filter on this.
Great. Yeah. Okay. And so this client literally walked through my door. And the reason she got referred was because her occupational therapist was like, I don't know what to do with this person, but a concussion is the brain. The brain is the nervous system. Natasha's the neurophysio in town. So let's send her to Natasha. And this person walked in and sat in front of me. And I was like, I looked at her and I was like, I'm going to be really honest. I have no idea what to do. I said, but if you're willing to work with me, I'm willing to learn. And now whether it's because like she had nowhere else to go, I was her only option. She stuck with me and she fully recovered. Like she's back. She went back and like did her thing, like riding her Harleys and all the stuff that she was doing. But it was literally that like vulnerable moment of, as a clinician, if you get that person, be honest with your client because they will appreciate that from you more than you creating some bullshit answer to make yourself sound smart. And I think a piece of that, so when we look at why my treatment is different, there's multiple, honestly, I'm going to say there's multiple different reasons why. Is one, I'm human, right? So many of these people I've been clinician 5, I've been clinician 42, right? Like people have been multiple providers. And the biggest freaking thing for every person that comes into this practice is they feel like they haven't been heard. They feel like they're just being told what to do and they don't fucking understand what's happening. And the biggest thing I educate on in my program before, like in addition to all the neurophys we dig into, is you need to create an environment of safety. And you can't create an environment of safety if you're sitting on your high horse ego. Because that in itself, you creating an environment of safety puts your client in a more receptive space for healing. And also then as your therapist gives you this, like, I don't know, people, if you're listening to me, I'm like drawing a picture with my hands here of like, but it opens the window of space you have to now challenge them as opposed to them feeling unsafe. There was this girl, She came into the clinic, worked with me, and she wears an Aura ring. I freaking love that we have such easy access to health data now.
Yeah.
And she's like, Natasha, you need to see this. She sends me the screenshot of her heart rate data.
Yeah.
Literally, the moment she walks through the door of my clinic, her heart rate drops. It drops even further through our session, and it stays lowered for like the next 6 hours of her day. And that's literally, I said to be like, all that is the nervous system perceiving safety and moving out of fight and into sympathetic or into parasympathetic. So number one, in terms of like, I am a human and I'm compassionate, and I really do harp on the power of creating safety and connection, as opposed to, you look at all these clinics where people go in, especially the persistent client.
Yeah.
And it's like a busy clinic and there's 10 plinths and there's music and it's really bright. Can you imagine walking into that as a concussion client?
No, God, no.
Right? And like the amount of stories that you hear of like, I asked them if they could turn the music down and I was told no. And like all these different things. So just from an environmental safety perspective, like creating safety, like that's number one. Like that is, and I do say to every provider in every discipline, that's your magic bullet, is that.
Yeah.
But then secondly is truly how we approach treatment.
Yeah.
Right? So I am a huge thing on integrative rehab, and how, when you look at how the healthcare system is just built as a whole, everything's built in silo, right? Like our cardiologists do the heart, our neurologists do the brain, our rheumatologists look at like the immune system, right? If you look at even at our professions, occupational therapists do cognition, physical therapists do MSK and some neuro, naturopaths do hormones and nutrition, right? And it's very siloed, and you can't treat concussion that way. Because when we look at how our body works, nothing works in silo. Everything is integrated all the time. And so for me, you look at like someone comes into my client and I'm doing what I call like a full multi-system screen, which means I have objective tools and measures, both bedside assessment and technology, that let me look at the autonomic nervous system, the visual system, the vestibular system, the cervical system, the SI screen affective and cognitive, somatosensory system. And I look at what is working well in the brain and what's not working well, and then what's talking well and what's not talking well. Because I always say, there was this story once of this person that was like, Natasha, this mom did everything right. She messaged me on Instagram. She's like, my daughter had a concussion 4 days ago. I got us into a clinic. And I was like, yes. I'm like, amazing. And I said, let me know what they like, how it goes.
Oh, no.
And she messaged me from the clinic. And she's like, hey, Natasha. So I asked them, because I teach them, like, there's 7 profiles of concussion.
Yeah.
And I'm like, which is those things I just listed. And I'm always say, like, get them to explain to you, like, where's, like, what profiles is she experiencing? Because if you can explain that to the person and then link that to their symptoms, it gives them so much more context and grounding that their anxiety comes way down. And so this mother asked this person, and I keep saying, I'm like, I hope this was just like a miscommunication.
Yeah.
But the therapist said to the mom goes, they told me that there's not different types of concussion. They just treat symptoms. And I almost had a heart attack. Like, I was just like, I almost was like, fucking run. Is if all you're doing is treating symptoms, let's just take dizziness, for example. One of the most common symptoms of concussion, right? Dizziness can come from the eyes, dizziness can come from the neck, dizziness can come from the vestibular system, dizziness can come from the autonomic nervous system, dizziness can come from anxiety. So if you're just treating dizziness, but you haven't assessed the roots that would drive that dizziness, what the flying fuck are you throwing at them to treat?
It's like whack-a-mole. It's like one pops up, you smack it. Like, did that one work? No, it's over here. Shit. Ugh. Yeah.
Exactly. And so I was like, we just saw this masterclass, and I say, like, the client with, this is kind of like another example to how, like, we treat the root, which then expands up into the tree and the symptoms, right? So it's like that client that has unresolving neck tension, for example. And you've been treating the neck, and you're doing manual therapy, or you're doing chiro, or you're doing massage, and it's good for a day or two, but it just keeps coming back. Maybe let's think that the neck's not the root driver. The neck might be driving the headaches, sure, like absolutely, if the tension's that thing, but if the neck tension keeps coming back when you treat the neck, then something else is driving the neck tension.
Yeah.
And so one of the examples I always guide clinicians through is like, well, what else drives neck tension? Well, when you can understand how the vestibular system relates to spatial awareness, and how the vestibular system relates to blood pressure, and you can understand these different pieces, you can see how by just treating this one element of the vestibular system, it dominoes into the neck tension, the blood pressure issues, and the anxiety issues your client's having. So where we're different is that's what we do. We have the ability to look at this full systems assessment of like the whole picture of how the person is, find that root drivers of what's driving the other things, and addressing the root and watching it domino and layer. And then that's why we get changes in people in 7 days that they haven't had for years.
There you go.
I could talk forever about it, obviously.
No, I love it. That's why I was letting you. Do you ever see, so like when we heal certain people through certain things, there can be like at the start, all signs point to dislocation. And then as you start that healing process, it's like peeling back layers of onion and you're like, oh shit, things got better. But it was actually due to this that we were previously unaware of. Do you see that as well?
That totally happens for sure. Right. So it's like someone will come in. And so the way we work and the reason people can fly in and work with me is we do this week intensive program. So people come fly in. Monday's the assessment. And I always say it's the starting point of a treatment plan. Yeah. And then we treat throughout the week. We reassess on the Friday. And then I support them virtually for 3 months after. And I always say it's the starting point because as you start digging into it, the onion reveals itself. And you're like, oh, okay, we thought it was that, but like, oh, okay, now I see this like little subtle shift in eye movement. That means something.
Yeah.
Like, so let's tweak and adjust. And I love the model we works so well because I see someone for 3 hours every day. And so those little nuanced moments where you can like layer in the smallest little bit. And because it's also fresh in my mind that I can see and I can feel and they're talking and they're sharing, it's this beautiful dance between practitioner and client. And the safer they feel with you, the more they're going to share. Mm-hmm. And when they share, like what they say to me in response to how I do something too is huge. So like, for example, I have a client here this week and we're working on this element of her vestibular stuff and it was going okay, but I was like, something is like, and she was describing this feeling. She's like, Natasha, when we do this, she's like, I feel like I'm almost like short circuiting a little bit. That was her description. And I was like, okay, interesting. And so from there, I like layered another piece on to drive further into this system. Mm-hmm. And we did it again. She's like, it's a bit better. But I was like, so I took another layer to like that. Cause there's so many ways you can fuel a system, right?
Yeah.
So then I added another stimulus to like drive into this system even more. And the short circuiting stopped. But without her feedback, I mean, I would have missed it. None of us are perfect. Or it's like, I shouldn't say I wouldn't have missed it because we were treating it. It just would have taken that much longer.
Sure.
And then there's other things too, where it's like, you totally think it's something. And then you're like, oh, I didn't see this. And then you like shift and you adjust. Yeah. And that's why I always say like the best laid treatment plan should be prepared to be thrown out the window at any time.
Yeah. So. That's true. And I think, I mean, driving in the safety piece, and again, with being somebody who's had concussions and probably far more than I even remember having, because that's also a piece of concussions, right? So, and, spear tackling with your head back then was kind of the thing to do for the highlight reel. So yeah, I jacked my neck up and all of this stuff. But the piece, honestly, was like the safety piece. And it's not just like safety going into a doctor's, because I never went to a doctor's office besides when I got jumped and I had to, try to work on healing my brain. But never had anybody ask those questions because I was fearful. And then I also bred into, as a man, there's like insecurity behind it. And then with not knowing, like even having this conversation, like I should probably fly to Canada to come see you, just have you just run some scans on me just to make sure. Cause to be honest, like if there's a period of time, right, where like I may have like 3 days in a row of headaches and like I never have headaches ever. And if I can't pinpoint what the cause is, my worry system goes into overdrive and I'm like, shit, like is this something that I need to worry about? Like I've done like neural examinations, neural zoomers looking for like different, things that may be damaging the brain, all came back like crystal clear. But because I never really did anything post concussion, there's still that fear in the back of my head. And ultimately it's because I didn't know anybody that knew what the hell they were talking about. Nobody made me feel safe with it. And they all made me feel like I was just stupid or I just needed to just get back on the field. So hearing you say that, it just again drives home that reassurance. And the more you trust the clinician you're working with, the more it will lower that sympathetic nervous system, because you're on high alert at all times, because your body, your main processing system is under attack. So you always feel guarded. And until you feel a safe spot, you're not going to drop your guard down. So I appreciate you, Natasha, really like making that safe space for people to come into so that they can truly heal.
Thank you. Yeah, it's really unfortunate because one of the things I do that not here is I consult for people around the world.
Mhm.
And I don't consult to do rehab because I'm not gonna lie, like I like to have my tech and like I like
Yeah,
to see what I need to see
sure.
like my nudist eye movement possible. I don't know if that's the smallest eye movement possible.
That's fine.
But what I do when I consult is to give education, guidance, and help build plans. Like that's what my consults do. And the amount of people that, and it's all by like word of mouth, but like the
Mhm.
amount of people that I consult with that are just like, we do 1 hour, and at the end of that hour, they're like, thank you. They're like, I've seen so many people, and in 1 hour with you, I understand more what's happening, feel more confident and hopeful than all the providers put together that I've seen. Like, thank you, but that's not okay.
Yeah. Yeah. It's like, thanks for feeding my ego a little bit, but like, I think more people
just like pumps
yeah.
me up a bit, but like, it shouldn't be that way.
Right. Oh
Like,
man.
so but one of the big things, and when I mean, you've said it, like you experienced it, and when you talk to people with concussion, the biggest thing in the beginning is they don't understand what's happening in their brain. They don't know how long it's going to last, and that's scary as shit.
Yeah.
And so you need to address that. Like you need to talk about it. You need to reassure them. You need to like explain what the heck is happening and what they're feeling is normal. And you need to give them some context on like, this is what recovery looks like.
Yeah.
And if you do that, like, then perfect. Like you're going to bring that anxiety level way down, because the higher, like we've talked about it, like the higher the anxiety levels are, anxiety is the sympathetic nervous system. Like it's the physical manifestation of fight and flight. And when we're in fight or flight, you could talk about this better than me. Like our inflammation levels are higher, our immunity levels are down. Like that is not an internal environment for healing. And I think, it's so funny. Like I think I shifted my practice to have this like really foundational component about the nervous system probably in the last, I'm going to say like 3 years. And a lot of it was through my own journey of healing my own traumas, to be honest. And it's been like huge and fundamental in how I talk about it. But it's like the amount of people that don't go there and then don't understand that like when we live in this state of sympathetic and fight or flight, like there's physiological responses that are happening that like prevent healing. And you can't heal when you live here 24/7. And so it's like for any provider that listens to this or any human, like there needs to be, and I always say too, sorry, this is my tangentingness.
Go for it. No, go for it.
And I'd be curious actually to hear if you experienced this at any point in any of your concussion journey. The biggest thing I think I see, particularly in my PCS people, so the persistent concussion symptom population, you lose the ability to trust your body. You lose the ability to trust what you're feeling is true. And which is a bit of a catch-22, because to begin to understand, to shift your nervous, and I talk about the states of the nervous system as different levels of activation within your body, and to begin to adjust and shift the state of your nervous system, you need to be able to be connected to your body to understand what you're feeling. So there's absolutely this like conundrum of like when I've been on this journey for months or years, I don't trust what my body's giving me. So now how do I start to get back in my body and not dissociate, to then trust what I'm hearing, to then know how to shift my system? But we also know dissociated states and dissociation, all that stuff can be linked to the vestibular system. So again, that comes to like the full picture assessment and then empowering the client with tools while doing the specific rehab as well.
Yeah. No, I love it. I never experienced that piece of it. The thing for me was the things that I felt when I had the near death experience, if not death experience. I think I probably died on the table from it, because I mean, I probably did. It was pretty intense. But like when I came out of that, I had the subdural hematoma. I had blood that was draining from my nose for about 4 months after it. So I constantly thought that I was like bleeding, and I probably was. And then they also told me, like, if I started failing tests, because I was going to chiropractic school, they're like, if you fail tests, if you start getting headaches, the situation may be way worse, and it may lead to mental retardation or death. So I had that, right? And then going to chiropractic school, I had a guy with a neurology diplomate that basically told me to drop out of chiropractic school and go get a $250,000 spinal cord surgery because I couldn't tell the difference between a cold piece of metal and a chapstick container, which I can understand from the outside. It's like, oh, that's pretty intense. And like, that's where I was. So like, if I ever come across instances where like my hands will go numb, or maybe I like work out too hard and I like mess up my thumb, or I burn my thumb on a cast iron and I forget, and I go to touch something and it's like there's no sensation, immediately trips back into my body like, oh shit, like am I going backwards? And I have to like calm myself down. I'm like, no, idiot. Like you burnt yourself. You got a freaking callus on your hand. Of course you're not going to have sensation there. So mine's more like if there are any resurgence of symptoms and things, then I do fear those things. But it was because of the program that was put into my head when I got released from the hospital. So,
but that speaks so much. Oh my God, you just like fueled my next tangent.
Yeah,
like
go for it.
That speaks so much to the power of mindset and old programs and old narratives, and how much the beautiful thing is like you recognize what those are for you, and so you can retrain them.
Yeah.
And that is a huge piece that I do see come up in the space as well, right? Is like when we look at the holistic approach to healing, we absolutely have to do the neurophys stuff, obviously, but we have to look at lifestyle habits. We have to look at mindset, because all of those things drive into, and I always say they drive into the resting state of your nervous system. And if the resting state of your nervous system is here, and I have a window of like 2 inches to challenge you, that doesn't give us much space to help you rehab. But if we can lower the resting state of your nervous system, then that gives us a whole lot. But that resting state is also compounded from different traumas, different stories, different programs, different narratives, different experiences. And so this is where, when we talk about like personal development, and I always say like personal exploration and deep work, everyone's got to fucking do it. Yeah. Because it's such a big piece of healing. And just as entrepreneurs, it's like the fuel to like what actually takes us to the next level as well. Yeah.
And I'm going to ask you a question I feel like it is an important one, and it's going to be a tough one. Maybe not.
Cool.
Okay. So strap up here. So, I'm ready. All right. So what I found, like I worked on sending you a patient, like we were talking about before we hit record here. And there's a lot of people who are yelling from the rooftops on Instagram, social media, where it's like, just fucking tell your mind to do it and you'll do it, or just push past it, or just, do affirmations and you'll be just fine. What do you say to that?
Kindly?
No, fucking tee off.
It's bullshit.
Yeah.
Right? They serve I shouldn't say that. They serve their place, but that's all conscious, logical thinking. All of that. When we talked about in the beginning about how like your nervous system goes into fight or flight none of that's conscious. It's all unconscious. It's all our nervous system taking in past triggers, past cues, environments, and unconsciously making a decision that you're not safe. So you could tell yourself you're safe all day long, but if your body doesn't feel like it's safe, it doesn't matter what you tell yourself. And so for me, it's all about actually getting into your body first and finding the tools to help calm and settle your body, to then change the narrative and change the story. Because if you're all ramped up, so I always say like when I'm in like fight or flight or sympathetic, like I get like the heebie. It's the same pattern for me. And people have patterns of activation in their nervous system. People, like the common thing, especially if we're kind of dissociated or not tuned in, is like, it just happens. I'm like, no. Like when you start to actually like learn yourself, like there's different patterns, but there's like patterns of activation that happen. And so for me, it's like, I get irritable, and then I start to feel constricted in my chest. And then I say like, I get like the creepy crawlies up my arms and it's the worst feeling in the world. And then I feel like I'm going to like explode out of my chest, and then probably don't talk to me because I'm going to bite your head off. Like I now know my like ladder of, I call it a ladder of activation.
Yeah.
If I'm at the state of bite my head off and I'm like, I'm great. It's beautiful. It's awesome.
Yeah.
Work. But if I can if I can transfer the energy and shift the energy in my body first, then go to my affirmations of like, I am strong, I am calm, and I couple it with
Hmm.
breath, then it might have some impact. But if unconsciously there are these triggers that are continuously happening, or there's a pattern that you keep falling into, you can logically tell yourself things over and over and over and over again. But until you address the root, you're going to be fighting that or working extra hard on that all the time.
Thank you for saying that. No, and I had a feeling we totally agreed on it, but it's one of those. It drives me fucking crazy. Like, to me, it's another holistic band-aid for what you're going through. And
Yep.
so you can yell at yourself, and if you're like, hey, like Goggins drives me, that guy drives me crazy. He may be a specimen, he's a freak, but like he needs to stop pretending everybody is like him. I think he's, of a different breed. But I also think, and this is my personal opinion, I think he's going to die very young, and nobody's going to understand why. And I think it's because he never shifts out of his sympathetic nervous system, and he's always yelling at himself, and that's not healthy to be there. So if somebody is super fatigued, and you wake, like if I'm super fatigued, I'm like, wake the fuck up. Like, just go to the damn gym. Stop being a bitch. Like, just fucking go. And I go, and my body's like, it doesn't really seem like you're respecting me right now. I told you were fucking tired. You don't need to exercise when you're tired. You're going to smoke your adrenals more because maybe you've got Lyme's, or maybe you've got some other infection, or maybe you've got some sort of brain dysfunction that's happening. And your body's like, why aren't you fucking listening to me? I'm trying to tell you you're not safe right now. You're fucking doing the thing that's the least safe. You're causing more stress to the body. And then people get stuck in this paradigm where they're like, well, so-and-so told me that I just need to work harder. Or so-and-so just told me that I just need to exercise more. Or I just need to do this. And so to me, that, and just me personally, it drives me fucking insane because so many people fail, and then that stacks on to the lack of worthiness. And like, well, I guess I'm a failure. I guess I'm not like those people. Those people are better than me. And it's so, yeah. So anyways, I appreciate you saying
that. Yeah, like I'm on this thing right now. Is like I took myself out for lunch. So I do I do a bunch of shit for myself, and like my own deep work and my own growth and like all this stuff.
Yeah.
And one of the things I do is hypnotherapy. And I came out of a hypnotherapy session the other day, and because I always say, like, one of my gifts is the blending of science and spirit and intuition and science. Like, that's very much one of my gifts. And I'm sitting there trying to like draw this diagram for myself, because like for people to wrap their head around that sometimes is they're like, well, science, spirit is woo. And I'm like, well, there's a reason. Like, so I heard this speaker, she's a phenomenal speaker, and I was like mind blown. In the work they do work around resilience.
Okay.
Or she does work around resilience. They can't have people in their studies that have a strong spiritual practice because it confounds the results. Because they're always outliers that they can't explain.
Yeah.
I'm like, that should tell you enough.
Why don't you go study them? Like, that's what right? If you're an outlier and it's all consistent, study why and how.
Normal population, right? Like, let's look at the normative, really. Like,
yeah,
but so I started drawing this thing about like, okay, well, the science is like we have hard science around like the neurophysiology. We have science now around like what lifestyle habits do. We have science around these pieces. And I was like, when I'm looking at like like the spiritual side of thing, like, what am I looking at? And I was like, I started just doodling, and I was like, well, that's like trust in self, belief in, I love that you said this, like belief in self, self-love, belief in something bigger than ourselves, like a higher power. And I feel like the bridge kind of between the two that there is research around is this concept of self-compassion. And if you can't have self-compassion, then you can't start to have depth and self-love and self-belief and all these things. And it's this piece of like, I go back to like screaming at yourself in the mirror. Like I woke up for 2 years, I woke up every day, and the second I put my foot on the ground, I felt like I was going to puke. Like, every single day, I felt like I was going to vomit for 2 years in a row. And it was this piece of like, and I would look at my sleep data. Sleep data was great, but I was exhausted and felt like I was going to hurl. And I was like, I had good sleep hygiene. My sleep data was great. And I was like, what is going on? And for me, it truly was like, I was in a really not great place. Mentally, my anxiety was through the roof. My PTSD at the time, which now I can say, like, I would almost say I don't have PTSD anymore, but like my PTSD at the time was not great. And there were all these factors. And I could have like, and it started with like, Natasha, get your fucking ass out of bed, like go move your body, like do the thing. Clearly that didn't make me feel great.
Yeah.
And I literally just shifted to like, I would wake up in the morning and I would say one of the easiest ways to actually reconnect with yourself is to like put your hand over your heart and actually feel your heartbeat. Because like you can't not be present if you're not feeling your own heartbeat. So I would literally like wake up in the morning and I would put my hand on my heart and I would just breathe and just be like, it's going to be okay. Because affirmations, there needs to be some belief in what you're saying. If you're saying something that you can't actually have any belief in, like you're doing yourself more harm than good. And so for me, I'd like literally lay there and I would like take a breath and I'd just be like, it's going to be an okay day. I didn't say great. I didn't say fabulous. I'd be like, it's going to be a good day. And then I'd be like, what am I going to do? This was literally the era of when I was like, if you don't prioritize yourself, you can't serve anybody.
Yeah.
And it was like, what am I going to do to help? And this is what actually started my like deep dive trek into all the nervous system stuff. Like I was living in like anxiety and fight and flight. And this is when cold plunging became my everyday to help me gain capacity and resilience in my nervous system. That's what started to take me down to like intense therapy and EMDR and hypnotherapy. I did sound therapy. This is where like I'm more woo than people probably realize. Like hypnotherapy, like somatic therapy. Fuck, I've done it all. I haven't done medicine or anything like that, but the different therapies and like meditation, like
sure,
all the shit.
Yeah.
Yeah.
No, it's great. I mean,
again, it's all with building self-love, self-compassion, and self-worth again. And I don't think you get that by yelling at yourself in the face.
Yeah, I agree. The cold plunging thing is something that there's all these twists on how to do it, how not to do it, etc. But at the end of the day, if you're like, I don't know what to do, some of the research is also solidifying, saying, listen, take a warm shower and freeze the shit out of yourself for 30 seconds at the end of the shower. And that can have some benefits. And that is at least getting your, I don't want to say your toes wet because that's quite literal on that, but you are. And when you're talking about like the science and the woo and all that stuff, like science is good, but also contaminated. And if we look back, we go hundreds of years back, right? If we were just talking about breathing, and people were like, how the fuck are we breathing? And science and man had no idea. Like, yeah, I don't know. We just have to have faith or we have to believe that we're going to breathe. We don't understand it. It's a miracle. It's woo-woo if you try to figure it out. If you try to measure it, who knows if it's right? And then we figured it out. Allegedly, I feel like, we figured out maybe at like a 70% capacity because I feel like there's always more that, God doesn't necessarily want to show us because we fuck it up when we find out. But then it's like, okay, now it's science. And so then you move on to the next thing, like the heart. And it's like, oh, okay, well, I don't know how the fuck the heart works. That's witchy. I don't know. Something got put in there and let's not mess with it. And then science figures it out and like, oh, science now. So all the woo-woo stuff is man's lack of ability to be able to understand creation.
I love that. The way you
That's it. That. So, and like, I get fearful, like Megan and I talk about it all the time. Like when they legalize something or like they're studying psilocybin, I'm like, oh, fuck. I'm like, there goes that. And she's like, what do you mean? I'm like, well, once man figures out what it is, like humanity figures it out, then they're going to turn it synthetic. They're going to patent it and they're not going to allow us to use it for its natural healing benefits. So like anytime there's more research going into certain things, like I'm cool with you kind of understanding the body. Like I think Da Vinci was way beyond his time. I have his whole autobiography. Biography. It's amazing. But like mapping things out was cool. Understand it to a certain extent to make innovations and help people live. Sure. But then don't pretend like you know everything because you don't. That's the biggest problem. Like it's not just one way. And when you're talking about pigeonholing people and like anytime you go to an neurologist, they're full of shit because they're specialists in just like a little itty bitty topic of the body. And I remember going to Penn State and one of my kinesiology professors was just like this. He was out there, man. He was like this tall, like white-headed dude. And he's just like, it looked like, oh my gosh, John C. Reilly. I don't know if you've ever seen him. What he'll do, like he's like drinking wine and he's just like kicking back and he's acting all like ridiculous. Like that's what the dude reminded me of. And so we did this philosophical debate where we were like talking about mind, body, and soul. And so he was like, define mind, body, and soul. And it was a trap. And so we're like trying to figure out like, okay, what has to do with the mind? Where's the body? Obviously the body's the body, and the soul, like, well, it's the soul. And so we would all like present like what our take was on it. And he goes, you guys all failed. And we're like, what? He goes, there is no separation of mind, body, soul. It is all one. And we're like, son of a bitch. But like, it sticks with you because it is true. And if you continue to try to silo the body, I've never heard the silo part. Like I always like quantify or like pigeonhole. But if you try to silo the body and separate things, you're always going to fail. 100% of the time, you're going to fail. And that's what medicine has been doing is they're trying to label. And it's like as quickly as we can get a diagnosis, they don't care about the cause. As soon as we can find out what the category of symptoms are, then we can stack a medication to it. Then we can send you on your way until you come back with new or worsening symptoms like every medication states. So that's what makes you very unique in what you do. You've got the passion for it. You've got the drive to learn. You're willing to admit when you don't know, and then you study so that you do know. So it creates this beautiful dance between things. And this is a segue here I'm working on it, I promise. I'm tangenting.
Yeah, like I have
well.
a tangent. Like I'm going to throw something in there too, but I'm like,
So tangenting from the brain piece of things, and a lot of people don't understand this, but if you do get a concussion, there's another area of the body that's going to instantaneously be affected, the gut. So talk to me about the relation between concussions and gut, or if you want to tangent and get into that, that's fine as well. What was your tangent?
Yeah, so I'm going to like drop one comment because it was so beautiful, like what you said, and then switch to that. So I was giving a presentation once. So, and you probably hear it in your practice too, like the amount of people that get told this is as good as you're going to get.
Oh, I fucking hate that.
And I did that, right? So I did this presentation once. I presented to a room of physios. It was awesome. It was like standing room only. It was great. Like one of the most fun ones I've done.
Yeah.
At the end of the presentation, I was like, do not ever let me hear you tell a client that this is as good as you're going to get. I said, who are we? Who are we to think that we can tell someone that they're not going to heal or change? I said, healing comes in miraculous ways that we can't fucking understand or explain. So don't you ever tell somebody that this is as good as they're going to get.
Yeah. There's science on that too, where your body, if you go into an oncologist, like nothing's scarier than getting the diagnosis of cancer, because most people don't understand it. I don't give a shit. Like if I were to somehow get cancer, I'm like, oh, fuck, I did some bad stuff and I just need to figure out what caused it, fix it. My environment's changed. I'm good. Like that's my take on it. I don't fear it. But when it comes to the C word, when people go in and they're like, hey, you had this, get your affairs in order. You've got X amount of months to live. They've done science to show that your body will actually wire itself to die. If you truly believe you've got 3 or 6 months or whatever it is to live, you will die almost to the day that they predicted. So I'm glad that you tell people that. And I'm like, hey, listen, I always say that, hey, there may be some limitations of matter, but I'm never going to put limitations on your healing potential because I'm not the one doing the fucking healing. It's between you and God. Like whatever, miraculous thing is going to occur, let's just get your body right and see what happens. And it does. And people are like, how did this happen? I'm like, I don't fucking know. Like I eliminated this infection or did this and there you go. You're good to go.
I'm good to go. Yeah. So. In terms of the gut. So the way, and I honestly, when the gut starts to get involved, for me, I approach it from a nervous system perspective. And then I also kick people over to funk med or naturopathic to see if there's some support we can do in the process as well.
Yeah.
I say, like, I believe in the power of collaborative care, and especially when people too think on the same wavelength of things. I recognize where I'm not strong. And then I pull in people who are strong in that area to support me and the team and the person as a whole. But when we think about the gut, and we think about people start talking about, so what I hear the most is like, I can't digest food anymore. Like I've had change in like food sensitivities, or like I'm constipated, or I have diet, like one or the other starts to happen. And for me, when I think back to the nervous system, it's like the vagus nerve. And that's our dorsal branch of our vagus nerve that runs all the way down into our gut. And there's actually links between like the vagus nerve, the gut, and Parkinson's, right? Like that's a whole avenue that's being explored with Parkinson's, is that it's like Parkinson's actually starts in the gut and travels in the vagus nerve to the brain. Like, so we know there's like copious amounts of research by this point in time. Yeah. And anyone who says that this isn't the case can go anyways. But we know that the autonomic nervous system is impacted after concussion. We
Yeah.
know that, right? The way you see it show up the most in the research is in blood flow to the brain. That's what gets studied the most. But when you look at the autonomic nervous system, it controls fucking everything in your body. So how is it just affecting blood flow to the brain?
Yeah.
Like that's not the case. And so when you look at, so I'm a big fan of the polyvagal theory and like Stephen Porges and like how he looks at the autonomic nervous system in that way. And so when we have like our states of like dorsal vagal, sympathetic, ventral, I mix them up all the time. Ventral vagal, sympathetic, dorsal vagal, right? Our ventral vagal is the one that drives safety, connectedness, parasympathetic, and it's what fuels like above the diaphragm to the heart and all these lovely things. When we don't feel safe, that goes offline, for lack of a better term. We're in sympathetic. Sympathetic, we know physiologically when we're in sympathetic, obviously, that we don't send blood flow to our gut, right? Digestion doesn't happen. Like that doesn't happen in the sympathetic state. And so, and then if sympathetic goes offline, then you're in dorsal vagal. And dorsal vagal is very much like, so it's the branch of the vagus nerve that goes down to like the lower part of the body, but that's energy conservation. That is like, I'm going to curl up in a ball and barely breathe and like slow my breath rate because I don't know how much longer I have to live. That's immobilization. So that doesn't fuel digestion either, right? So to me, when I start to look at like what's happening in the gut, it's that piece of what's happening in the nervous system. But then I honestly kick it over to my colleagues to be like, you go deeper.
It's true. I mean, and I think it's been in the last couple of years or so, they've really started studying the link between concussions and the gut. And, you know, just instantaneously from what some research will state is it instantly, like as soon as you get the concussion, boom, you automatically have gut permeability, which is super fucking dangerous because if you had any stealth infections or any candida overgrowth or bacterial overgrowth, you can develop the state of endotoxemia that's just localized. But if the gut opens, then it goes systemic, and then you're carrying inflamed blood up to the brain. And then some of that stuff can cross the blood-brain barrier, or leaky gut can lead to leaky brain. And it just develops this like massive problem. And then it's like, you know, you could have been super healthy, then you get a concussion, and then you have IBD. And you're like, how the hell did that happen? Well, you put on your thinking cap and like, oh, logically, I hit my head. Now my gut sucks, like cause, effect. And then you have the cycle that just goes and goes. So I love that you pair it and you have people who are like, okay, let's take a look here and see if there's anything else going deeper, you know, in the GI tract. I'm going to handle up here, you handle down there. So we'll tackle it together and we'll bring everything back into a parasympathetic state. Because yeah, once you tap into that vagus nerve, even chiropractic, like there's specific, you know, sects, if you will, of chiropractic that just adjust the atlas and C2, so atlas and axis, because of that. So the vagal nerve and the brainstem, the spinal cord tension. There's so many theories of it and why it's so dang important. So I feel like we could go off on this for like a really long time, but I think it's really really great and really amazing that you're able to, again, know where your thought, and I guarantee you could figure this stuff out. You're very smart, but like to be able,
but I don't need to be good at everything.
Yeah. Well, that's what I'm saying. Like so that you can just delegate. It makes it so much easier. And it makes you better at what you do too, as long as you have somebody that you obviously trust, which I know you do. Otherwise you wouldn't have them in your practice. That'd be silly. But yeah, like I'm trying to see these other things. So I think the other piece of that, so the gut hit that takes place, right? And I can go off for hours on the gut health piece and what can happen. But one of the things you said too, and I've obviously experienced this too, is when you have TBIs, traumatic brain injuries, or concussions, there is a hit that also gets placed on sex hormones. Can you talk about that?
Yeah, so there's more and more research coming out. This is one of the areas, though, still to this day, like you'll go to a general doc and be like, I had a concussion and like I feel like my hormones are out of whack, and they're like, concussions don't affect hormones.
Yeah,
they do.
Give them a concussion and say good luck.
Typically, the research, some of the stuff that I've read, is it's usually something that obviously presents a little bit later into the recovery, right? So, yeah. But from a from a female perspective, where you have your concussion in your cycle is showing matters, right? So when we look at like that second half of our luteal phase, when our progesterone levels are higher, particularly if you're not on a progesterone-based birth control, then if you experience that concussion in the second half of your cycle, those women tend to have a higher symptomology and a longer recovery. And the theory is because it's a deeper drop in progesterone just because of where we were in our cycles when we had this injury. That matters, right? So the research is just starting to now actually divide gender and realizing like women and men with concussion are the same. But when you try to look at other things, at least the research that I read the most recently, I need to update my thing in this too, but it's usually the sex hormones that get affected first. So men, it's going to be testosterone. Women, it's typically progesterone, but then there could be estrogen. And then after the sex hormones, it's actually looking at growth hormone. And then beyond the hormones, again, this is where people are much smarter. It's also looking at things like, what is our iron, but not necessarily the iron, like what is the ferritin levels and what are all these pieces? So it can go down that route, but hormones 100%. And with men in particular, like there's been several men that I've talked to, like testosterone was a significant factor, and women for progesterone too. Like I was just chatting with someone the other day, if you had a regular cycle, so as a female, if you had a regular cycle leading up to your concussion, and all of a sudden you don't have a period for 4 months, clearly something has been affected with your hormones.
Yeah.
And the other thing that I'll say too, and that another one of my colleagues have said too, is from a symptomology perspective, again, female and like cycles.
Sure.
If your symptoms tend to get significantly worse in the few days leading up to your period and right after, there's typically going to be a hormonal component there as well. So you might still get your cycle, but you notice that like symptomology significantly increases right around when your period starts. Get your hormones explored too. But this poor girl was just like, I didn't have a period for like 4 months, and now it's like sporadic. And I was like, she's like, can hormones be affected? And I was like, yes. And yours probably are. Like, please go find a funk medicine doc.
Yeah. It's tough. I mean, and when you talk about progesterone dropping, just pouring a little bit into the hormonal thing to, again, be like, hey, this is why what Natasha does is so important, so valuable. When you drop your progesterone, you drop your fertility rate. And so the rate of fertility or infertility and miscarriage is going through the damn roof. And if we can't make our bodies feel safe, and we can't produce enough progesterone, then there's no way you're getting pregnant. The other piece is going to come with that as well is going to typically be more of a long-term thing, where if your progesterone does drop and so you do miss your cycle, if estrogen remains at its normal level, then you're going to have estrogen dominance, which is going to create more weight gain. It can create more gut infection, create more candida overgrowth, and create more hormonal imbalances, and it just snowballs. And then you have this excess fat, then it leads to insulin issues and leads to type 2 diabetes. That could also lead into type 3 diabetes, which is Alzheimer's. And it's like, oh, wait, we're back at the brain again. So all of these things stack together. And I know that when I had mine, my testosterone, boom, immediately tanked. I think it went down to like serum level of like 97. It was like embarrassing. It was like high for a woman. And I'm like, what the hell is going on here? So fortunately, I know what to do to try to bring those levels up and things. But I think that it is a very underlooked portion of concussions at this point. And if we think about athletes with concussions, if you're a woman, right, and your cycle's dropping, you may think that's convenient for the time being because you don't have to worry about, cleaning yourself up while you're competing. So it may not be a big issue in your head. You're like, hey, this is great. But for men with drop in testosterone, it's very dangerous because testosterone is also cardioprotective. It's going to protect your heart. So if you're still trying to exercise and perform at the same rate in which you did before, you shift into a catabolic state where your body's breaking itself down. Your heart is breaking itself down while you still increase the amount of stress that's on it. You're leading yourself down a path of serious sickness, disease, and potentially a cardiovascular event. So I wanted to make sure I stacked upon that knowledge.
This is where I nerd out, because that's the stuff that I could listen to forever and just be like, give me more.
God, it's just
funny too, because I feel like there's this space in the acute concussion space right now, right? So there's research now that it's like we have indicators of when someone might shift into a persistent state. But so often you hear, or I hear, because people send me their story of like, I went to this clinic and they put a hot pack on my neck and told me to go exercise. I'm just like, that person, I told them to fucking run.
A quick segue on that. So Canada's a little bit different, right? Because you guys don't do insurance, right? It's all natural Healthcare?
No, it's all out of pocket. It's like insurance and out of
Okay.
pocket. Yeah.
Okay. Because I was going to say, like, when people say it
We
to
can go
me,
to the hospital for free. That's about
okay.
it.
Gotcha. Because I was like, when that question or when that approach pops up and you go to like a chiropractor, I'm like, I bet they bill the shit out of your insurance. And the patient's
Oh,
like,
yeah.
wait, what? I'm like, yeah, they're going to get paid a fuckload for doing all those stupid things that aren't really going to get to the bottom of it. And you're going to have to continue coming back. So they're going to continue billing you. So
Yeah.
that's my take on that. But go ahead. So number two, what was the number two thing? Sorry.
So you hear this, or you'll hear people like, I go to this clinic and they like, I had good neck range of motion, or they did a Buffalo concussion treadmill test and they said I'm good, so I don't have a concussion. And I'm like, they screened for one type of concussion.
Yeah.
And so when I'm educating providers in like all the fucking free talks I do and like the shorter workshops I do, it's like in the acute phase, you need to screen for everything. You can't just do an exercise test. You can't just do a cervical, like you need to screen for all the phenotypes. If you're not, and you fucking miss something, you're setting your client up for a longer recovery. And it's just like due diligence. Like if you say, this is where I get angry, obviously.
Yeah.
And
I
you
love it.
say you're a concussion clinician. And I say concussion clinician because it's not profession specific. Like in my nerds program, we have PTs, OTs, acupuncturists, chiros, athletic therapists. We had a neurooptometrist once, we had a naturopath once. Like, I don't care who you are. It's your job to operate within your own scope of practice.
Right.
But if you say you're a concussion clinician, you better know how to screen for all the phenotypes. Or if you don't, you better know who is in, you better have a network to immediately refer to finish screening. Because if you don't, you're doing your client a disservice.
Yeah.
It's like, it like frosts me.
Well, it's the tough part with that too is like when you're going, again, the safe space, right? And I forgot you brought this piece up, and I always try to do this too in my new patient consults is work on reestablishing hope that their life can be better. It's so important. And if somebody abuses that, it's like an abusive relationship. And then if you go and you're like, oh, okay, well, here's what I'm going to do, and here's what we're going to do, and it sounds anything similar at all to what they heard, and it could just be with how you said hi or how you dressed, doesn't matter. They automatically go into I don't trust you. I don't trust you. I've heard that before. And so what pisses me off is then people go and if they have depression, but it's concussion-based depression, then they go jump on an SSRI or some other medication. You're like, fuck, you screwed it up. Like, you kicked them back to the system that wasn't treating them right to begin with because it was easier, and at least their symptoms are a little bit better maybe from taking this medication, but you drop the ball, and then it makes it so much more difficult for clinicians like yourself that actually know what the hell they're doing to then reestablish a trust. It's like, throwing a rope down into a well, and you're like, just hold on to the rope, and somebody's like, well, somebody else threw me a rope the other day and I climbed up and they let go. I'm like, well, I'm not going to do that, I swear.
And the skepticism builds. I think the best compliment I actually ever got from someone was she came for an intensive and she said to me, she's like, Natasha, she's like, you were the exact same in person as you are online.
Yeah.
And I was like, because that congruency into and that authenticity of who I am into what they saw and what they expect matches what they got equals safety.
Yeah.
If someone is showing up expecting something and it doesn't match with what they receive, that's a threat. They're in fight or flight. Like, you have to work that much harder to now build trust. And it's funny because I'm usually like, I'm a very compassionate, loving, like, kind person. And then there's sometimes that I get really fired up. And I don't get really fired up on my Instagram very often, but sometimes I'm just like, sometimes I go off, and it's hilarious because whenever I do, I always get these messages like, I love seeing you when you're like this.
It's passionate. It's passionate. Like, it's passion.
Concussion. Was it?
Oh my God. Yeah. I saw it. Yeah. 2 years ago. Yeah.
I went online after that one. And
I saw that. Yeah.
Like, if you know me, you knew that I was like vibrating when I did that reel and posted it.
Yeah.
Controlled vibrations, but like, oh yeah, there's times, and it's usually spurred by a patient story or like or the two thing where I was like, why the fuck wasn't he pulled?
Yeah. There's no, yeah, that hit. And it's really difficult to just watch football just in general. Like, I love the sport, and whether you think it's scripted or whatever the hell is going on, I don't know, maybe. But one of the things that I see is like Christian McCaffrey is a phenomenal running back. He is a absolute specimen of a human being. And when I see people specifically targeting his head, and like they'll try to spear tackle him in the head and try to knock him out, or they'll try to go for like the knees and stuff. Cause I got out of football because of two knee injuries. I'm like, so I'm very empathetic with those types of experiences. And like, I know the damage that's going to occur. And I always think about, do you watch football often or not too often? No. Okay.
I watch it sporadically.
So there's a player for the Steelers. His name was Antonio Brown. And the guy's a fucking idiot right now. He's a moron. But he came across the middle, and this linebacker just like took his head off. Just done. Just laid flat, just out. And it was one of the worst hits that I've ever seen in the league. Like, holy crap. And after that, he was never the same. Like, he was maniacal. Like, he wasn't making sense. He wasn't the same athlete. Like, everything went downhill. So going from like the sports background, that's also why my son's never going to play football, whether
my son's never playing football.
Yeah, he may get mad at me, but I'm like, listen, like
my son's asked. I'm like, nope.
Yeah, what are you stupid? Like, no, you're not doing it. Like, it's, any axial loading sports, you got to be careful. Like soccer, you're going to get concussions. Hockey, you're pretty much going to get concussions. Boxing, obviously.
My son plays baseball.
Yeah, well, my son does karate, and they spar a little bit. They're just like tag sparring.
He raced BMX for a few years.
Nice.
And then he wanted to try baseball, and he freaking loves it. And I'm like, sweet.
Yep, there you go. I love it. And baseball's great. Yeah, it's fun to watch. But yeah, so being able to have this approach, I know we have to be sensitive to time and everything, but with all the stuff that we literally just dumped, we just like, I feel like we turned on a fire hose and just poured information out for people. Like, this is probably the most information packed podcast I've done, which is awesome. Where can they find you? What are you offering? Do they have to come in person for the intensive? Lay it all out there for people so that if they do want to meet with you or follow you, at least follow you on Instagram, how can they do that?
Yeah. So first, Instagram is the easiest way to reach out for me. I am in my DMs. I chat to everyone. So it's just at Natasha.Wilch on Instagram. And then I have avenues for people who are on a healing journey, and then avenues for clinicians. So my big mission is to elevate and evolve the culture of concussion globally. So clearly I'm not doing that alone. So for clinicians, and I say, I talk with clinicians, PTs, ATs, chiros, naturopaths, anyone who is passionate about the concussion space, I have a 6-month clinical mentorship program that I do called Concussion Nerds. And it's 6 months because you need time. And it's a mentorship program because that's how you catapult your skills. And it's also I've created this core curriculum took me 10 months to write. And already I'm like, I need to add this and I need to add this.
Yep. It never ends.
It never ends. So there's a self-paced core curriculum that you work through. I say to people, I'm like, you get these really beautiful workbooks. I added them up this last because we just did a launch for our program. You get 460 pages of workbook. So I actually kind of wrote you a textbook.
Yeah.
So you get this self-paced core curriculum, you get mentorship with me and live calls and in a community, and then you get this amazing community of clinicians who absolutely share your passion. So Concussion Nerds is, as a clinician, if you really do want to go deeper into everything we talked about today, we bring guests in. You're going to come into Nerds. You didn't know that, but you're going to come into Nerds. We bring guests in again, I know my weaknesses, and I want the nerds to have exposure to phenomenal humans as well. So that's for clinicians. If you're ready to be a leader in this concussion space, whatever that looks like for you, I realize not everyone wants people flying to work with them from around the world. You just might want to kick ass in your community, but that's how you do that. So just reach out to me for that piece. We also have an event coming up, actually.
There you go.
We have a 2-day event in Vancouver. So it's called the Concussion Nerds Roundtable Experience. Okay. It's 1 day of deep diving clinical mentorship where we're just working through case studies and the bits and pieces, the nuances, building treatment plans with each other through this scope. And then the second day is business hot seats. So whether it's brick and mortar clinics, whether you're in an online space, where you're at in your business and how can we help you with that next step to heal your. So that's in April in Vancouver. People on a healing journey So I do, if you have concussion, I do a free call every month just to like give back. So it's always like we talked about dysautonomia this month. For example, next month we're talking about the power of rest and what that actually means and looks like. So that's a free call. And then I do consults. So we talked about this earlier. I do consults for people around the world as well to help guide them in their healing journey and that piece too. So there's multiple different ways to get into my world and work with me. The easiest way is send me a message on Instagram.
Yeah. Call it the no excuses approach. There's no excuse not to be able to reach out to you. You're in person, you're virtual, you give free stuff away, you message on DMs on Instagram. It's only people getting in their own ways if they don't want to reach out. So
in person, full disclosure, like I'm fully booked until pretty much October at this point.
Nice.
But I have a phenomenal team that have gone through like that I mentor and support and train. So for people who are flying in to come work with us or even local people, like there's multitudes of options to work with amazing patients in my clinic as well.
Awesome. Well, yeah. So reach out, obviously. So Natasha.Wilch. We'll put all that stuff as well. Everything, your website as well, Natasha-Wilch.com. So I'll have my team throw all of that in the show notes and things as well. So you can just click and go. And then obviously as this video goes up on Instagram, we'll tag you in it. So people will go over there, start following you and start seeing what you have to offer. But thank you again for taking the time out. I don't think that our work together is done. The podcast is for now. But
I feel like we could probably go for another 3 hours, to be honest.
Easily. Maybe we just need to have our own like weekend seminar or something like that, where we just like hash it out or something. But maybe we'll throw that in the books. But thank you again for doing this. We'll definitely be in touch so that we can kind of collaborate together. But I, again, really, really, really appreciate you finally getting on. It's been my pleasure to have you on the show.
It has been super fun and honestly an honor. So thank you.
Yeah, you bet.